Okay, so here we get our key point, the murmurs. The murmurs are usually produced by turbulent flow. So the mechanism of murmurs, what we call murmur, what do we mean by murmur? Murmurs are abnormal heart sound. Abnormal heart sound. It is produced by turbulent flow across abnormal, because we've already know that normally the cause of heart sound are usually turbulence of blood flow inside the heart. But when we hear a murmur, we fulfill two criteria. Number one, turbulent blood flow. Number two, either abnormal valve, the valve is abnormal. If the valve is normal and there is turbulent flow, you will not hear a murmur. So if there is here abnormal flow or septal defect, so there will be a defect in the septum, for example, the atrium or in the ventricles, or there is an outflow obstruction. Stenosis, for example, there is an outflow obstruction from the, for example, the outflow obstruction of the left ventricle or the right ventricle. So there will be a turbulent blood flow across either abnormal valve, septal defect, or outflow obstruction. شباب واضحة الميكانيزم of murmur, where the murmurs will produce inside the heart. So these are the two principal mechanisms. However, this is a term, what we call it innocent murmur. يعني شنو murmur that is benign. So not all murmurs are significant or we consider it pathological. There is some what we call it innocent murmurs. When it will produced, it is usually produced by the increase the velocity of blood flow. So we know that the blood flow is turbulent, but when there is an increase in its velocity, it will produce an innocent murmur. However, it should have a normal valve. So there will increase in the intensity or increase in the velocity of the flow across a normal valve. When the velocity is augmented or increased, it usually occurs in normal physiological conditions when the stroke volume is increased. So what are the causes of an increased stroke volume? For example, when the blood volume or the plasma volume is already expanded. The common example is a pregnant woman. So you could hear a question, what are the normal cardiac examination of pregnant women? قبلها يعني we already discussed normal physiological extra heart sound. يا هو كان طلاب extra heart sound.
S3.
So S3, and there is what we call here an innocent murmur. An innocent murmur. So you'll hear a systolic murmur in addition to S3 قالوا in a pregnant woman, which is usually regarded normal. بعد athletes with resting bradycardia. Why athletes with resting bradycardia? Because bradycardia will increase the diastolic time, so the stroke volume will be increased. كل ما نطول بال diastolic time, so there's time for the ventricles to be filled with much volume, blood volume, and subsequently the stroke volume will be augmented. So we'll hear some innocent murmur. And the last one is fever. Fever is also a cause of S3 sometimes, especially in young age group. So the innocent murmurs, what are the characteristics? يعني شو وقت نعتبر هاي المurmur benign or not? طبعا from the clinical context of the patient, number one. Number two, usually innocent murmur is usually systolic murmur. يعني you should not say diastolic murmur is innocent murmur. It is usually systolic murmur. واضح طلاب؟ يعني don't say diastolic murmur are innocent murmur. Systolic murmurs, innocent murmurs are systolic murmurs. واضح؟ So it is not usually diastolic. The basic mechanism will increase flow across the normal valve, the aortic and pulmonic valve. And it is usually, the innocent murmur, one of the criteria, it is usually, its intensity is not hard. يعني ما أتوقع intensity of the murmur will be much louder. For example, grade 4 or grade 5. This is the classification of the intensity of murmur, usually grade 3. And it is usually not palpable. يعني مو إذا سمعت murmur, pregnant lady, palpate the heart and you find a thrill. And again, شنو الثrill? What is the definition of a thrill? شباب نرجع شوي على what is the definition of thrill? اكو احد يعطيني definition of thrill؟ بدور.
دكتور هو كراتشنج ساوند بس استوى بدأ الصوت.
لا thrill مو pericardial frictional. thrill is a palpable murmur. thrill definition of a thrill يعني murmur that is palpable. murmur can be heard يعني can be auscultated and can be palpated. When there is a palpable murmur we call it شنو؟ thrill. So innocent murmur, if you during palpation of the precardium you find a thrill, which is a scratching sound. Just this is a palpable. يعني the thrill, it is not an auscultatory finding. It is an palpatory sign during palpation. So if you find if you found a thrill, never say this murmur is innocent, because the innocent murmur are usually and always is always not palpable. Okay. So يعني معناها grade 3 and below. This is what واضحة طلاب innocent murmur. So it is usually systolic. Happen in these conditions. The etiology behind it. It is never palpable, and grade multi usually grade 2 to 3. It is best heard over the pulmonic, sometimes over the pulmonic area, over the left lower sternal area, and variable with the position of the patient. يعني أنت مثلا إذا هو نايم مثلا جزء تسمع المرمر، قاعدة جزء تروح المرمر. So it is variable. It is بينما المرمر, for example, إذا المريض عنده mitral incompetence, the murmur will always be present during sitting, during standing, but its intensity will differ. But the innocent murmurs disappear with the position of the patient. So the mechanism of murmurs: turbulent blood flow, again the abnormal valve, septal defect, or outflow obstruction. Timing شلون نقسم الميرمرز؟ It is classified in systolic or diastolic depending on what. يعني شلون اعرف المريض عنده هذا systolic murmur or diastolic murmur طلاب؟
دكتور ويا النبض أشيكه؟
Yes, with a pulse. So when you hear your stethoscope, if you hear the stethoscope, before you put your stethoscope on the chest of the patient, you have to palpate the carotid. So when you auscultate the heart, the sound that coincides with the pulse, this is the sound, the heart sound that coincides with the pulse. يعني أول ما خليت سمعت heart sound, and you at the same time simultaneously you palpate the carotid pulse become palpable. With the pulse, you hear the first heart sound. Okay, so the sound that coincides with the pulse, this is the first heart sound. So in conclusion, this the murmur that coincide with the pulse, this is systolic murmur. Definitely, when you hear the pulse happened in systole. The carotid pulse, when you hear the jerk pulse of the carotid, it is usually happened in systole. On the other hand, when you put your stethoscope on the heart and you palpate the carotid pulse, after disappearance of pulse, and you hear the pulse, and after you disappearance of the pulse, you hear a sound. This is the second heart sound, because it happens during diastole, after closure of the tricuspid and aortic valve. So the key principle to differentiate between first heart sound, second heart sound, and systolic and diastolic murmurs from palpating the carotid pulse. This is very important, fundamental in cardiac examination. واضح طلاب؟ So please always palpate the carotid before you auscultate the heart. أنت جزء من تخلي تسمع شلون تعرف هذا first heart sound or second. Yes, from the character you can, sometimes you can, but it needs a lot of practice. But the standard technique in the exam, you have to palpate the carotid and time the sound, heart sound with the pulse. The sound that come with the pulse, this is the first heart sound. The sound that come after the pulse, this is the second heart sound. واضح شباب؟ So timing, systolic and diastolic in respect to the carotid pulse and first and third second sound. لذلك تمام خلي يسوي palpation الكاروتيد. Once you examine the carotid pulse, you will define the first and second heart sound according to the timing. So this is an example of how to interpret the examination of the. And here we have a stethoscope. This is which area?
Mitral.
Yes, this is the mitral area. You put your stethoscope, time with the pulse, in order to know this is the first heart sound and this is the second heart sound. If you know the first heart and second, you can easily know whether this murmur is systolic or diastolic. How? Systolic murmur is usually, systolic murmurs occurs between S1 and S2. Definitely, because the S1 happens after closure of the mitral and tricuspid valve. There will be ejection of blood from the ventricle to the aorta, and followed by closure of the aortic and pulmonic valve. So this is the systole, and it is caused by turbulent blood flow. Here the patient has mitral regurgitation, which means that the mitral valve will not close properly during systole. There will be incompetence. So the blood flow from the left ventricle to the left atrium. So the blood will come from the left ventricle to the left atrium. So there will be turbulence of blood flow because from S1 to S2. And the murmur radiates throughout the systole. تشوفون هذا الأس1 هذا S2. This is the systole. So throughout it begins from S1 and ends just after the S2. نسميها pan-systolic murmur. شنو pan-systolic? Happens throughout the systole. Okay? So, in any murmur, you should consider the following. Consider any murmur in terms of, first of all, you have to time the murmur. يعني شنو time؟ نعرفها هي systolic or diastolic. شلون نعرفها systolic diastolic? By palpating the carotid. You can say this is systolic when it is coincided with the pulse, and you can say this is diastolic if it happens after the pulse disappear. Character, this depends on the pitch of the sound that's produced by the murmur, like مثلا musical, blowing in character, this is a blowing, while harsh murmur, this is harsh murmur. For example, of aortic stenosis, the character needs a lot of practice to know, and you can hear videos. I will later on and show you the murmurs and its characters, timing, loudness, how you can grade the murmur according to the intensity of murmur. يعني نقول this murmur is loud, this murmur is not loud, according to this classification. So what are the grades of intensity of murmur? It depends on this classification. Loudness or intensity are mnemonic, are synonyms. When I go, what are the loudness of this murmur, or what is the intensity of this murmur? It means you have to classify it according to the grades, from 1 to 6. This is the classification of murmur. So grade 1, it is heard by an expert. So it is usually not heard by a junior doctor. Grade 2, heard by an expert but in optimum conditions. يعني شنو optimum conditions تتوقعون؟ يعني usually heard by a non-expert but in optimum conditions.
مثلا دكتور ماكو صوت يعني او مكان مغلق.
Yes, very good. It should have a quiet room. يعني مو بالطوارئ ومرضى هوايه وهو some patient talking relatives وهاي الامور. So you will not hear this murmur. So it need an optimum condition. While grade 3, so grade 3 is usually easily heard. واضح؟ easily heard, whether it is in optimum or non-optimum conditions. So grade 3, it is usually heard. You can by your grade in your college career, so you can hear this murmur grade 3. Keep in your mind, it is what is written here, no thrill. شنو معناها no thrill?
Not palpable.
So the murmur during palpation of the cardium, you will not feel a thrill. You will not feel it. So the murmur is not palpable. Grade 4, so a loud murmur with a thrill. So when you present your murmur, there is مثلا grade 4 pan-systolic murmur in the mitral area. The examiner will understand that this murmur is شنو معناها palpable. يعني بالpresentation ما يحتاج يقول this murmur is palpable. You can only say it is there is pan-systolic murmur grade 4. So I understand that this murmur is palpable. Grade 5, it is very loud and heard over a wide area. The difference between 4 and 5 is the location and the intensity. Here is louder and it is heard over a wide area of the precordium, plus thrill. So when you say thrill, it means that the intensity of murmur grade 4 plus. معناها جزء grade 4, grade 5, grade 6. شنو اللي يحدد هاي الأمور؟ عادة the intensity of the sound, the location of the precordium, and sometimes it can hear without stethoscope. You can hear, just listen to by your ear, you can't see it without stethoscope. And this is very rare type of murmurs. You can hear it without stethoscope. The usual murmurs are usually grade 2, grade 3, grade 4, and عادة نهاية from grade 2, grade 4. These are the usual murmurs we hear in your practice. Sometimes you can hear a 5, sometimes 6, occasionally in grade 1. So, in the basic side of when you hear a murmur, you should time it, systolic, diastolic, character, whether it is musical, blowing, harsh, the intensity according to this grade. Here how important, area or loudest, يعني انت ممكن تسمعها over wide area of precordium, but what is the maximum area؟ انت سمعت murmur بالmitral, بالtricuspid, in pulmonic or aortic, but during auscultation you should decide what is the area of maximum intensity. Why? Because this will depend your conclusion. يعني انت سمعت area all over the precordium, but it is loudest over the aortic area. This means that this patient has aortic pathology. On the same time, you hear a murmur over all the auscultated area, but it is loudest over the mitral area. It means that the mitral pathology, here there is mitral pathology. واضح؟ هذا very important for localization. يعني تجي سمعت خليت الأوسكولتيشن over كلها تسمع كلها there is murmur here over the precordium. So how you can know this murmur come from which valve? By شنو؟ By locating the area of maximum intensity or maximum louding. Then the radiation of murmur. شنو يعني radiation? The radiation means that the flow of the murmur, يعني فرض المريض عنده هنا شنو هنا mitral regurgitation, mitral incompetence. The mitral valve will open during systole, but normally the mitral valve will be closed during systole in order to let the blood eject from the mitral valve from the left ventricle to the aorta, not to the left atrium again. So in patient with mitral incompetence, the blood will flow from the left ventricle to the left atrium. So the radiation of the murmur here, yes, it is usually here in the mitral, but it's usually radiated to the axilla. So if you hear a pansystolic murmur in the mitral area, you should go for radiation. So you should put your stethoscope, you should put the diaphragm stethoscope over the left axilla to hear the direction of the blood flow from the left ventricle to the left atrium. If you hear this radiation, you can confidently say that this patient has mitral incompetence. So like two important localization for the murmurs. First of all, to know first of all, you have to know its site of maximum intensity. Number two, the radiation of the murmur. يعني عادة the murmur of mitral regurgitation is usually radiated toward the left axilla. If you hear here a murmur, you come in your mind that the patient may have aortic stenosis. What do you expect the radiation? So the radiation is going to the pathway of the regurgitant blood flow. قلنا مثلا the left ventricle, where is the pathway for the regurgitation? From the left ventricle to the to the left atrium. So you can hear, you put your otoscope and you hear the radiation from the left ventricle to the left atrium. But the example here of the patient has aortic stenosis. So the blood flow or the blood jet will usually come from the left ventricle to the aorta. So where do you expect to find the radiation of this murmur?
left ventricle.
So the blood will come from the left ventricle to the carotid. Yes. Where the pathway of radiation يعني what تتوقعون تسمع أنت سمعت المرمر. You put your otoscope over the aortic area. You hear a murmur, a systolic murmur, coincide with the pulse, and you need you put your stethoscope over the axilla. You didn't hear any sound. There is no radiation to the axilla. You expect that this patient has aortic stenosis, which means stenosis of the aortic valve. So that will create turbulence of blood flow. What is the pathway of the blood jet during systole from the aortic valve?
Neck.
After ejection of blood, yes, to the neck from the blood from the left ventricle. Left ventricle is connected to the where? Aortic valve to the aorta. So it is usually right to the neck. What is the best site to look for the jet of blood in a patient with aortic stenosis? In the neck. وين نخلي عادة؟ إذا it's connected to the carotid. وأنا أخلي I will palpate شنو؟ I will auscultate, sorry, the
Carotid.
I will auscultate the neck. Yes, I will put, if you hear a murmur in the aortic area, it is systolic, I will try to auscultate the carotid and ask the patient to hold his breath at the end of expiration. Why? حتى ال breath sound, it will not make turbulence. يعني نخلي سماعة المريض يحكي أو يتنفس بسرعة. I will not hear because the trachea here is close to the carotid. I may hear transmitted sound from the trachea. So I will auscultate the carotid here. Ask the patient to hold his breath and to notice any radiation of this murmur. لازم ألقى نفس الكواليتي اوف murmur. صح الانتنسيتي ممكن تقل. يعني انت ناس مالت الميرمر جزنا جريد 4 من خليتها على الكاروتيد it is usually because of the distance from the aortic valve to the carotid. Yes, the intensity will decrease but the quality will remain the same. واضح ولا؟ So this is the two examples of the radiation of murmur. The radiation of murmur of mitral regurgitation and the radiation of murmur in patient with aortic stenosis. شباب واضح إن شاء الله؟ So this is the criteria. If you have any murmur, you have to know these the criteria. Now وصلنا للradiation. And lastly the accentuating maneuvers. شنو يعني؟ Any maneuver that make the murmur more clear, more louder. يعني جزء كانت هي مثلا grade 2 صارت grade 3 مثلا. شو تتوقع شنو الاكزامبل؟ إذا مريض عنده مثلا left sided murmur، يعني مثلا إذا المريض عنده mitral valve pathology. شنو هي maneuvers اللي أسويها حتى I will augment the murmur in this disease. طبعا هذا شنو الميكانيزم؟ produced by the turbulent flow. So anything that make the blood more turbulent, the higher the flow, the more likely the murmur will be augmented. So anything that make the venous return to the right side of the heart increase the murmur on the right side of the heart will increase. يعني مريض مثلا عنده tricuspid incompetence، حتى افرق المريض هذا عنده tricuspid incompetence or mitral incompetence، شو اسوي المريض؟ اقول له مثلا اقعد بالقاع، لا سكوات يعني قنبص بالقاع. This will make شنو يعني معناه؟ make the venous return to the heart will be augmented. So the murmur of the right side will be يعني أنا أخلي المرمر على tricuspid area it must be augmented during this maneuver. While it is kept constant means that this murmur is not originating from the mitral or so from the tricuspid valve, but from the mitral valve. So in summary, any maneuver that increase the venous return to the heart, the right-sided murmurs, يعني شنو right-sided murmurs? The murmurs that originated from the tricuspid valve, the pulmonic valve, this is the right side of the heart, will be augmented. بعد اكو maneuver يزيد الفينوس ريتيرن، شنو تعرفون اكو فد maneuver نسويها؟
مثلا
increase the venous return to the right side of the heart. Number 1 هو شنو؟ squatting from sitting position. يعني المريض يوقف اقول له رأسا اقعد بالقاع and you'll examine the heart. So any murmur that is augmented during this maneuver, it is usually come from the right side of the heart. يعني either the tricuspid or the pulmonic. بعد مثلا المريض نايم واقول له ارفع رجلك. So leg rising maneuver. I will raise his leg so it will شنو؟ there will be an increase in the venous return to the heart. واضح ولا؟ بعد ask the patient to take yes لا raising the legs will augment the venous return to the heart. So the murmur of tricuspid regurgitation will be augmented while the murmur of mitral regurgitation will become the same. يعني ماكو عادة the venous return run to the right side of the heart, not the left side of the heart. So squatting from sitting position, passive leg rising. بعد inspiration نقول للمريض اخذ نفس وانت نفس، اخذ نفس take deep breath repeatedly. ليش؟ ما قلناها بالجي في بي ايش حيصير؟ there will be an increase in the negative intrathoracic pressure, more venous return to the right side of the heart. لذلك واحدة من المانوفرز نسميها كارفالو مانوفر. شنو كارفالو؟ we'll put your stethoscope over the tricuspid area. You hear a systolic murmur. Instruct the patient to take deep breath. So after 2 to 3 cycles of taking deep breath, if the patient has truly tricuspid incompetence, this murmur will be increased. And the sign, as an Italian physician call it Carvalho. نسميها Carvalho sign, which murmur of tricuspid regurgitation will be augmented during inspiration. The murmur sometimes difficult, يعني murmur to the same quality. The quality of mitral regurgitation is similar to the tricuspid regurgitation. How you can differentiate? So one of the differentiating points شنو هو? Is Carvalho sign. Instruct the patient to take deep inspirations. بعد شنو differentiating point؟ إذا مريض عنده مثلا tricuspid incompetence versus mitral incompetence. Number one, has the patient take deep inspiration. نشوف المرمر to increase in its intensity. بعد
يزيد الفينوس ريتير.
Yes, any maneuver that increase the venous system, for example, passive leg rising, بعد squatting from sitting position, and you should not forget that the murmur of mitral regurgitation is best heard where تتوقعون إذا مريض عنده tricuspid regurgitation. What is the best site to auscultate for it? If the patient has TR, يعني شنو TR؟ يعني tricuspid regurgitation. The best site to hear for the tricuspid regurgitation شو تتوقعون؟ The best site to auscultate for tricuspid regurgitation. يا هو الميترال، tricuspid, pulmonic or aortic.
Tricuspid.
Yes, tricuspid. While the murmur of mitral regurgitation is best heard where?
Mitral.
Yes, definitely. So if you hear a pansystolic murmur in the precordium, how you can know this is, and this is a common exam question, how you can differentiate the murmur of tricuspid regurgitation from the murmur of mitral regurgitation? Here are the answer. Number one, the site of maximum intensity, here in the tricuspid area, here in the mitral nexus. So the site is very important differentiating point. The site of maximum intensity. يعني انت ترى المرمر of tricuspid ممكن تسمعها بالmitral area, but it is best heard where? In the tricuspid area. And it is true for mitral regurgitation. So number one, the site of maximum intensity. Number two, radiation. مو صح ولا لا؟ The murmur of mitral regurgitation will be radiated where? According to the jet. Yes, to radiate to the axilla. يعني إذا سمعت tricuspid وتشاك هل هي mitral or tricuspid, you should auscultate the axilla. If you hear the radiation, you hear the sound of the murmur or the same quality, this is MR, not TR. While the radiation of tricuspid regurgitation is usually toward the عادة المين from the right ventricle to the right atrium. So it is usually radiated to the right sternal border. Now نسمع المرمر here. Right sternal. Why? Because the direction of jet from the right ventricle to the right atrium. So it is usually radiated to the right sternal edge. So side radiation بعد شنو؟ السبيشال شنو maneuvers. The murmur of TR is usually best heard at the end of inspiration. المريض ياخذ inspiration, the murmur of TR will be augmented. And this is the basic explanation for the Carvalho sign. While the murmur, the left-sided heart murmur, is usually augmented at the end of, at the end of expiration. So this is for at the end of expiration. Now end of expiration. واضح ولا؟
دكتور دكتور ليش ما اعتبرنا انه pulmonary يعني راح نقدر نشوفه في pulmonary باعتباره هو regurgitation؟
Why pulmonary؟ يعني انت
انه على الجانب يعني الرايت سايد.
ليش؟
ليش قلنا انه
Why? Because in a patient who has tricuspid regurgitation, there will be regurgitant of the blood from the right ventricle here. مو شباب؟ Give a full view. There will be direction of blood if the patient has tricuspid. This is the tricuspid valve. Sometimes the valve will be incompetent. بس قبل أخلص أسألكم سؤال. الترايكاسبيد incompetence it is here in systole or diastole. خلينا نتفق على هذا الشيء أول واحد. If the patient has tricuspid incompetence, the valve will be incompetent. Where you expect to hear the murmur? In systole or in diastole?
Systole.
دايستولي.
سيستولي مفروض.
Systole.
تخيل يصير cardiac cycle. The valve will be incompetent. وقت بالسيستولي ولا diastole?
هو كلوجر فمفروض يعني بالسيستولي.
Yes, very good. The valve is usually closed شو وقت ينسد؟ هو بالسيستولي. Become incompetent during شنو؟ systole. This is the basic mechanism of murmur. During systole, normally the tricuspid and the mitral valves are closed. Why? In order to let the blood will be ejected from the ventricles to the pulmonic air to the pulmonary artery or the aorta. When the valve become incompetent, it is usually the blood will in comparison or in return to will go back to the left atrium or to the right ventricle. So please, the incompetence mitral or tricuspid valve is usually happened during systole. Why? Because in systole these valves are closed to prevent the blood to go back to the atria, and instead will go from the right ventricle to the pulmonary artery, and from the left ventricle to the aorta. So incompetence for the mitral and tricuspid valve is usually occurring during systole, while the aortic and pulmonic incompetence, occur usually close in diastole. So incompetence of these valves usually happen when in diastole. واضح شباب؟ Mitral tricuspid incompetence happened during systole, while the aortic and pulmonic incompetence happened during diastole. The mechanism انه the valve should be closed. The valve should be closed. Mitral and tricuspid should be closed in systole, so it become incompetent during systole, while the aortic and pulmonic valves closed in diastole in order to prevent the blood to go back from the aorta to the ventricles or the pulmonic artery. So it is usually closed in diastole, and the incompetent valves, pulmonic and aortic valve, happen during diastole. So here to the question of the student, when there is tricuspid incompetence, the blood will go back. This is the chest of the patient. Okay, this is the mitral area. This is the tricuspid area. Okay, this is the right sternal border. So in tricuspid incompetence that occurs during systole, the blood jet will be directed from the base of the heart toward the right sternal border. The right sternal border of the heart, right atrium to the right ventricle here. يعني شفناها بالsurface anatomy. So the blood will be ejected here from the tricuspid area toward the right ventricle here, not the neck, because the neck there will be the pulmonary artery. The blood will be during tricuspid incompetence will be ejected from the right ventricle to the شنو مو aorta ولا pulmonary artery, will be ejected back again from the right ventricle to the right atrium. The right atrium is located towards the right sternal border. Here the right atrium. واضح شباب؟ The direction of flow will be here from the right ventricle to the right sternal border. بينما إذا المريض عنده mitral incompetence during systole, the blood will be ejected from the left ventricle toward. يعني عادة left atrium located posteriorly. يعني أنت عادة surface anatomy of the heart, the left atrium is located behind the left ventricle, يعني posterior structure just anterior to the esophagus. يعني عادة location of the left atrium يختلف عن location of the right atrium. The location of the left atrium is behind the heart, behind the left ventricle, just in front of the esophagus. إذا تتخيلون surface anatomy. بينما the right atrium is usually located anteriorly, just to the right border of the heart. واضح طلاب؟
واضح دكتور.
اوكي. نرجع So this is the classification of murmur. واضح طلاب؟ So نعيدها آخر مرة إنه the classification of murmur depend on timing, systolic or diastolic. بعد intensity according to this classification, grade 1, grade 2, grade 3, grade 4, grade 5, and grade 6. The site of maximum location, where the tricuspid, the aortic radiation. This is very important, discriminator in the localization of where the murmur come from, and in addition to the lastly to the accentuating maneuvers. And here I will summarize my lecture to wrap up. So, in summary, auscultation, it is the listening of the heart sound using the stethoscope. Number one, use the diaphragm to listen to all the 4 precordial areas. So I will choose first of all, this is the diaphragm, and this is the bell. And there will be a switching lever to switch between the diaphragm and the bell. First of all, you should use the diaphragm, timing the pulse. لا بدي اشرح لكم على انتبهوا على الفيديو ما تسعوه في الباوربوينت. تشوفون الستethoscope؟
لا دكتور.
شباب بس اباعوا لي هاي تشوفون هسه حاليا حتى to summarize my lecture. This is the هذا شنو هذا؟ This is the diaphragm and this is شنو؟ The bell, and there will be lever to switch between the two. تشوفون شلون دافرها؟ من افرها هنا من تنفتح الفتح هنا معناه اكو bell. So this is the site of auscultation and this is for the diaphragm. حتى اعرف اني على الdiaphragm على البell, I usually when I hear the stethoscope I gently tap the diaphragm in order if I can hear the sound of tapping clearly, it means that I am switched to the diaphragm. يعني مو خلي السماعة بعدين اطلع كل شيء ما اسمع بعدين انا طالع خالها على البell. This is a common mistake during examination. المهم, so I will auscultate the 4 auscultatory area, يعني the mitral, tricuspid, aortic and pulmonic with the diaphragm. When I خلي على mitral area, I will concentrate on the first sound. When I switch to the pulmonic and the aortic area, I will concentrate on the second heart sound and ask the following question: if the first heart sound is normal, is it quiet or loud? When I transfer to the pulmonic and aortic area, I will ask this question: if the second heart sound is normal, loud or quiet. Then I will switch. Just a few seconds. I will switch the diaphragm to the bell. I will use the bell of the scope, and I want to خلي the bell of the scope over the mitral area. This is specifically over the mitral area. Then return to the scope to the diaphragm. Ask the patient to sit up and lean forward, hold the breath in expiration, and listen to the aortic area. يعني عادة رح نخلي diaphragm over the all 4 auscultatory area. Then I will switch to the bell, put it over the mitral area to listen to the specific murmur of the, because why? The bell, it will catch the low frequency sound, while the diaphragm, it will catch the high frequency sound. So if you don't switch to the bell, you may miss a grade 2 murmur that originates, for example, in patient with mitral stenosis. So the bell can be used to listen for the low frequency sound, for example, mitral stenosis. Or sometimes قلنا S3 and S4, these are low frequency sound. So it should be here with the bell. إذا مريض عنده S3 بس أنت سمعت بس بالdiaphragm, لذلك you missed the S3. Why? Because it is a low frequency sound. So you should switch your stethoscope to the bell. So please, in mitral area, always switch to the bell and roll the patient to the left side to augment the murmur or any heart sound produced in this area. For example, S3, S4, or the murmur of mitral stenosis. Again, the murmur of the left side of the heart is best here at the left lateral position, and the patient should hold his breath at the end of expiration. من نكمل هاي المانوفر وراها نقول للمريض اقعد, lean forward, put the diaphragm of your stethoscope over the mitral area. Ask the patient to take deep breath and then breathe out. Hold your breath at the end of expiration. Ask the patient to hold his or her breath at the end of expiration, and time always with the carotid to listen for the murmur of aortic incompetence, which happened during Murmur of aortic incompetence happened during diastole. Lastly, if the murmur is heard, then you should auscultate for any radiation in the axilla or over the carotid. So this is the basic techniques for the examination. Here, this is the summary of the auscultation. So in the auscultation, you have, first of all, identify the first and second heart sound by timing with the carotid. Then you should identify the third and fourth heart sound, elicit any clicks or snaps and murmur in respect to systole, diastole, timing. Timing, it means systole, latent systole, it needs a lot of experience, but in your grade, you have to know whether the murmur is systolic or diastolic. This is very important. Then the duration, is it early in systole or whole in the diastole? But it is out of your scope in your third grade, and just have a look on the duration of murmur, because sometimes the murmur is just early in the systole or respond to whole the systole. وهكذا. The character, like blowing, harsh, musical, the pitch and intensity, this will depend on the classification, the site of maximum location, where it is located best here in the mitral, tricuspid, aortic, etc., and the radiation. Lastly, the pericardial problem. And by this, I will end my lecture. So please, if you have any questions about the content of my lecture, I know it is initially it is very hard, difficult to digest, but with the time, with the practice. So when you finish reading this lecture, try to apply your knowledge by auscultating a normal. Please auscultate your father, your mother, your brother, your sister, in order to get know the normal heart sound, the normal character of the pulse. So it needs a lot of practice. This is only a theoretical knowledge. You should apply. And don't know the abnormal. You should know first of all the normal. You should know the normal heart sound, first heart sound, normal second heart sound, the normal pulses. Then after that, with the time, with the practice, you can know hear the murmurs or the extra heart sound. I will give you a lot of videos to show the normal heart sound and the abnormal heart sound. Lecture of the in your Google platform. I will stop recording by now.